Welcome back to our conversations about collaborative program planning. And today we're going to be talking about collaborative design. And just so that you're sure, we're not going to be talking about goals and objectives or action plans. We're going to be discussing something a little bit different. And that is a mindset shift. As we explore what it means to move from the idea of designing a program for other people to designing with. Now, obviously, we're designing for our audience. We have an audience in mind, but very often in collaboration, we design the program and then we go to our partners and ask them to help us implement it. And that's very different than what we're going to be talking about today. I'll remind you of the Institute of Medicine's definition of public health. And I did add safety because we should have safety, right? But public health is what we as a society do collectively to assure the conditions in which people can be safe and healthy. And so we know that. We're all in health and public health, so we know this theoretically. And yet I think many of us have this challenge. And I'd like to ask you to think about the organization in which you do your IVP work and ask yourself, in my organization, is collaborative injury and violence prevention program design considered a luxury, a recommended practice, or an essential practice? Now, I know what we'd like the answer to be, but what is it really? And I think that's important because the answer to this question shapes our approach to program planning. So yes, it's true that relationships, good relationships, require work. They do. Partnerships and collaborations require a lot of work. But they're the greatest injury and violence prevention resource mobilizer that we have available to us. And they're also so much more than just a source of resources. This is an old quote from Christopher and Gallagher in their wonderful book, Injury Prevention and Public Health, but it's still so relevant, and so I'm including it here. We find ourselves in such complex settings. They're complex politically, socially, economically. We're dealing with decades of history. We are dealing with structural racism, embedded structural inequity. We have histories that we're trying to maybe understand or compensate for. And we also have all the different players with all their different agendas and all their different worldviews. And so learning how we can navigate most effectively through organizational, political, and other practical realities to implement meaningful injury prevention programs is a really important skill for us in this field. However, the challenge is that often we find ourselves attempting to navigate in the design phase in situations where things are very unclear. We know the risks of driving in these kind of conditions. And so these are the risks of designing in these kind of conditions, that we may think we know where we're going, but we don't actually have a clear vision of where it is we're going and how we're going to get there. And so I think it's very important for us to pay attention to this. Here's a problem. When we work in social and political and etiological complexity, the risk for misperception increases. So in other words, when we're working in something that's foggy or complex, the chances that we'll miscalculate or misinterpret things that we see or hear goes up. The opportunity, though, is that when complexity becomes challenging to us to navigate, remember there are other people with other reference points and other experience who may be able to add helpful perspectives. Now, I'm not sure if you know what this image is that you're looking at, but here's an illustration of what can be given to us when people introduce new perspectives. So I might be struggling to interpret what I'm looking at here, but through diverse relationships, I have diverse opportunities to learn. So somebody else may look at this and say, oh, I understand what you're looking at. I have a point of reference here. So these new reference points that people give us may help us interpret what it is we're seeing and hearing. They may help us recognize what we may not be seeing, not be hearing, or not be understanding, and they expand our worldview. So now, with this new point of reference that's been introduced, looking at that picture, what do you think you're looking at? Yes, it's slices of red onion. But what made it hard for us to interpret when we looked at it was that this image has had its color pattern changed through 180 degrees. Now, this is important. You may say, look, Carolyn, I'm not going to be looking at green onions when I'm in the community. But remember, when we look at something, we look at it through our worldview. We look at it through our frames of reference. And sometimes those frames of reference, although they feel true to us, may not be true of the environment we're working in, or not be true for the people with whom we are working. And so it's very important that we find the people who can help us expand our worldview. And a question that I often like to ask during design when we're making assumptions about what's going on. So we'll say, all right, based on this, we're going to do this, we're going to have this response. I invite people to challenge themselves and say, okay, let's for a moment imagine that all the assumptions that we're basing this program decision-making on are 180 degrees wrong. What if everything we thought was true was not true? Now, mostly they might be true, but that's the discipline of checking your assumptions. So let's look at some of the key points about why collaborative design is so incredibly protective. Remember, no one person, program, or agency can achieve meaningful change, even if we had limitless resources, which we won't. So people say money is always the issue, but actually, even if we had the resources, we couldn't and shouldn't be doing it by ourselves. Collaborative design leverages diverse perspectives. It leverages people's skills, their strengths, their resources, their reach, their physical reach, their social reach, their political reach, their trust reach, their credibility, and their influence. And then collaborators and stakeholders are more likely to be invested in and committed to a program they help co-create. There's an old saying that says, I comply with your goals or your vision, but I commit to our shared goals and our shared vision. And so we're looking for something that will motivate commitment in our partners. And of course, when we collaborate, our collective impact far exceeds our individual impact. So where do we start? Start with the commitment to collaborative assessment of the injury and violence prevention issue you're focusing on. So don't do that by yourself and then come to design. Start right at the beginning with your partners involved, and we have already discussed how to use the multisectoral influences matrix to do that. Now, although you may be tempted early on to identify what the possible intervention options may be for your issue, you should not pre-decide what intervention you're doing. Please don't do that, because the risk of doing that is that you'll want to use your data and everything you hear to confirm what you believe to be true. Keep an open mind, keep that beginner's mind, which says, what is there for me to learn here that I don't already know? And also, of course, commit to using evidence and your stakeholder input to inform your current and future decision-making. Now, which of the injury prevention E's are we considering? That's another important thing for us to think about in the design phase. The turquoise dots are the ones that we have. Obviously, the traditional ones, education, engineering, enforcement. People often add economics. People often add emergency care. But I also particularly like this graphic from a relatively new article from Giles et al., where they suggest that no matter what E we're looking at, engineering, enforcement, education, we should be adding the equity E, because that's a very important consideration as we design. It's not just how do we enforce, how do we educate, how do we give people access to engineering solutions, but how do we do that that keeps equity in mind and addresses our historic inequity in injury and violence prevention. Another thing to consider early on in the design phase is, what is your intended level of influence? Now, this is the spectrum of prevention that Cohen and Swift published in Injury Prevention in 1999. And you can access this at the Prevention Institute, along with many other wonderful tools that go with it. This is important for us to ask ourselves in the design phase, like, are we wanting to strengthen individual knowledge and skills, or are we wanting to move up into influencing organizational practices or policy or legislation? Are we trying to work with coalitions, networks, advocacy groups? And it's important we ask this for a couple of reasons. Firstly, we want to be trying to move up this spectrum and stay away as much as we can purely from individual knowledge and skills. Cohen and Swift also advocate that we might consider a combination of levels of influence. But your level of influence will also influence the stakeholders that you need to be working with, the people you need to be involved with you in the design phase. And so that gets us back to then thinking, well, once we know which area we're working in strategically, what level of influence we're hoping to have in the community, we then would ask ourselves, who are the people who may understand and have influence in this context? You've already started this thinking with the multisectoral influences matrix, but it's important to think beyond our usual partnerships. We often have a set of very familiar, very comfortable relationships when we work at injury and violence prevention. They're the people we always see at our coalition meetings, or recently have seen on lots of Zoom meetings. They're people that we have an affinity for, perhaps we share values with. However, they're not the only people in the universe. And so ask yourselves objectively, who are the people who have the influence here? Whether they're on our side or not, they still have influence. And who do we need to be engaging, working with, and learning from? And here's something that many of you may have heard me say before. One of the risks of establishing collaborative relationships, especially when we're establishing them between organizations such as police, fire, EMS, the health department, a faith community, maybe a recreational facility, is that we tend to recruit people with their job titles and their agency titles. We need a representative from the fire department. We need a representative from education. We need a representative from emergency medical services. But you know what? That's not how we build teams. That's not how we build relationships. It's the respect for the individual person and their specific skills, leverage, influence, preferences. That's what we need to have to build those relationships. So yes, perhaps we do need somebody from a certain civic group, but we also need to engage with them around their personhood, their individuality, and the things they care about. I cannot emphasize this strongly enough. Because here's why. People don't stay in collaborative relationships because of what they get out of them. People stay in collaborative relationships because of what they get to put into them. Because then they feel that the time that they're investing in the collaborative relationship is worthwhile. It's meaningful to them. All right, so then let's think about collaborative work and look at this picture and let's answer the question, what is wrong with this picture? What's going to happen when that next piece gets put in? Right? We can anticipate just based on gravity that this whole thing is going down, and that with this strategy, with the partners doing everything together, they are not going to get any closer to success than they already are now. And this is an important thing for us to pay attention to. Because what's important is that stakeholders collaborate to achieve results. But collaboration does not mean that those partners are doing the same things or doing everything together or at the same time. And so what we're looking for is that those relative contributions coming in from the different stakeholders help us achieve the outcome that we're looking for. Now you'll see that I put a little mark next to collaborate, a little asterisk. Sometimes collaboration means that a partner will agree to get out of the way. You know, we underestimate how important this is. Sometimes there are people who have historically not supported work, and they may not even feel that politically they want to continue to support the work. But if they're willing to just step aside and give you the space to do the work you need to do, that in itself is a great contribution to your work. So there's lots of different ways to collaborate and support. So during the design phase, one of the things that we need to do is to create a very clear picture of the individual programmatic threads that we will be combining to form the intervention. It's so easy to say we're doing intervention X or intervention Y, and it's a big lump. We all know that you never accomplish anything by having an objective that says complete project by December the 15th. Like it doesn't happen because it's just too ambiguous. It's too large an objective. We can't get the precision around it. And so as you think about the collaboration and how the collaboration is going to weave together to give you this hopefully multi-pronged comprehensive strategy in the community, take the time to tease out what those threads are. Now, let me give you some examples. And these are not completely exhaustive, but at very least, you're going to have to understand the issues and the opportunities. There's a thread there. You're going to have to be building some social and political will to do the work and some of the relationships. There's going to be some resource mobilization and some resource management that has to go on. There will be the planning and evaluation work related to your program. And of course, there's going to be the implementation work. And that might be more than one thing that you're implementing. And then together, you will see your combined impact. Now, this is important in the design phase for many, many reasons, which I'll get to. It's also important for program evaluation because it's hard to evaluate if you don't do this kind of thinking. It's hard to evaluate, who's doing what and what the impact is and how, for example, the quality of the work that was done to build social and political will made resource mobilization possible or made the implementation possible. So we're trying to get really precise about the different components of our program. So what we're going to try to understand here is which of the stakeholders are or should be engaged in which program threads and when. Now remember, when we build a partnership, not everybody can be involved at the same level of intensity for the same amount of time for years. They can't. And so sometimes when we're driving it, so it's our pretty significant time investment in the program, and we invite other people to join us, they'll say, well, we just don't have the time to join this. But if we've teased out the threads and we're able to get really precise about when we need help, maybe we need a little help early on building some social will or political will, and maybe we won't need your help during the implementation. That allows us then to recruit stakeholders in a very different way, in a way that's quite respectful of what they're able to give and what they're not able to give. So at the very least, we have to answer these questions for each of our partners. What are they able or willing to commit to? Are there any activities they may not engage in? They may not be allowed to engage in, legally, politically, whatever that is. Can we give them cover for that? And then what are their intended key activities and results so that our partners know what we are asking them to do, by when, and what we hope that they will be delivering. And it has to be something they feel that they can give informed consent to before they agree. Now, before you have a panic attack and look at this graphic and say, I don't know what you're talking about, Carolyn, let me just walk you through it slowly. We don't have to be this precise, but we can get some clarity. So if you look down the y-axis, we have S1, S2, and that would be partner one, or stakeholder one, stakeholder two, stakeholder three, partner one, partner two, partner three. And then we have a time period. It's over time. It may be months, it may be quarters, it doesn't matter. You define that. But imagine now that we have 7 different partners and we've given them each different color blocks. And we look at when we're going to need them. So for example, in S1 and in time 1 and time 2, this stakeholder is somebody that we just need for a short period of time right at the beginning. Maybe they're the people who help us find data, find resources. Maybe they help write a motivating letter for our grant application, whatever it is. S2, that's probably the program lead. That's probably the agency or the group that has got complete responsibility to make sure this program happens from beginning to end. But what you can do is you can see that different partners have different levels of commitment at different points in the program. It also helps us see sort of dependencies and contingencies. So if, for example, I know that we have to get the data and we have to get the evidence, then stakeholder one, it's very important that we're recruiting them and that they are able to engage in those first 2 time periods. Because if they're not available until time period 5 and 6, we can't move forward. So it helps us really sort of plot out who we need and when we need them and what they're doing. And I'm sure that you can imagine that this could be quite helpful in terms of process evaluation. Is it happening? Is it happening on time? And what's the satisfaction with it? And also our outcomes evaluation. So last but not least, I'm going to ask you, as you design programs, to respect and learn from your collaborators' previous work. You know, sometimes when we come together as partners, there are people who've done things, they've had programs. Sometimes they've had those programs they just love, and we know that they're not really evidence-based or effective, but they still love them. And here's where I'm asking us to approach these discussions with curiosity and with respect, and in a spirit of learning from our collaborators' previous experience. So what we need to think about when we talk about previous programs, instead of saying they were all good or they were all bad, let's ask some questions. Who decided to focus on this issue? Who thinks that this is a passion and a priority? How and why were the various activities selected? Who was responsible for planning, for funding it, for advocating for it, for managing it, for implementing it, for evaluating the activities? What is or was actually done as opposed to what was planned initially? Who are or who were the recipients, and were they the people you planned to reach, or did you end up with somebody completely different? What was the response both of the recipients of the program and the partners who worked in the program? What changes occurred because of this work? And remember, those changes aren't just injury and violence prevention impacts. They could also be that as a result of previous work, relationships were established, skills were developed, infrastructure was built. Maybe they didn't get quite where they needed to go, but they built trust with the community, or they discovered their blind spots. Just because something wasn't effective in terms of injury and violence prevention doesn't mean that there wasn't a lot of great value to learn about and learn from. And finally, how did or will this then support future changes? And I'm going to leave you with a final thought about collaborative design, and it's not mine, it's from one of my heroes, Nelson Mandela. If you want the cooperation of humans around you, you must make them feel they're important. And you do that by being genuine and humble. Thank you for joining me today.